What is going to happen and what is the cost going to be for the women who now have to travel possibly 45 minutes or longer to have their baby, the emergencies that are going to occur, not only with home births that don't go the way they should, that come rushing into our facility, to hemorrhages, diabetic crises, preeclamptic episodes. There's a lot of things to consider. And is our emergency room going to be able to handle those crises? And what is our maternal death and our baby death going to be if those crises aren't handled appropriately? So I think that, you know, 3.5 million is a lot of money, but I think in the end we need to look at what the ultimate cost could be down the road if we don't have our doors open anymore.
I worked in Philadelphia for 40 years in medicine, and every hospital that dropped its maternity ward eventually either was gobbled up or closed. And I don't want to see that happen here because it's not a good idea. I think that you have to look at different ways of making money, bringing money in. You know, whatever the hospital's really good at, push that out there and let people see it. Let them know what you do well. You do a lot of things well, and I don't think people know that.
Our costs have gone up for everything, for medications, for supplies, the cost to care for patients. And I'm not speaking on behalf of the hospital, let me just be clear. I'm speaking on behalf of the hospital district and many years in healthcare. So the costs continue to go up, reimbursement does not. And we're in a very challenging community from a reimbursement perspective. I've worked in New York, I've worked in California for over 30 years. And before I came here, and I love our county, it's a beautiful county, and we look outside. I mean, for all the reasons we all live here. But I can tell you that from a reimbursement perspective, I mean, when you know, any hospital is going to have a heck of a time operating in this environment. And it's not just for OBGYN services, maternity services, it's for lots of services. It's a very challenging, I'm going to use the term payer mix. That's the insurance reimbursements that we have in our county.
If we consider that 1 in 2 pregnancies are unintended, not necessarily not wanted, but unintended. Women of reproductive age, unintended. You didn't intend to be pregnant, yet you're pregnant. You live in a county that has the services but may not have it, that's going to scare away people. So, unintended pregnancies, you know, there's people that I didn't plan to be in a place where there is no obstetrics and gynecology, but now there's not, and I don't have it, and I cannot get transportation for the hospitals. They'll lose this service. Not only that, women have been underserved now for way too long. And if obstetricians leave because we don't have a job, then gynecologists leave. So women of reproductive age and more will be without service, or will have to travel even further to get their services. So to the question 3.5, is it worth it or not? Women should let us know.
But I mean, the Cleveland Clinic is inefficient. They are not user-friendly. They still do everything through Cleveland, and I'm sure you have heard plenty of the complaints. They've destroyed our medical community here. So I know you are very complimentary of the Cleveland Clinic. Unfortunately, as a physician, I cannot be. But I think you have to force the Cleveland Clinic to continue. But isn't it a contract? It's at least until 29. I mean, for 10 years. And I hope by that time maybe they've lost enough money that they'll leave town. Because you still need the help. Now that Orlando Health is here, Sebastian, that's a wonderful competition for them to have. So the hospital district is in fault to have selected the Cleveland Clinic, and if they cannot do what they promised to do, then it's your fault too, and you have to make sure that they do what they are supposed to do.
Thank you, Doctor. I just did want to make one clarification.